Okay, so renal tract calculi are kidney stones. Are the stones consist of aggregates of crystal containing small amount of proteins and glycoproteins can give rise to kidney stones. Nephrocalcinosis is also known as kidney stones are calcification within renal parenchyma from calcium deposits. It affects men more than women. Men are more prone to develop kidney stones in the age between 20 to 30 years. There are certain risk factors of kidney stones like low fluid intake. Those people who take low fluid and diet having high protein, high sodium, and low calcium in their diet are hypercalcemia because of hyperparathyroidism, because of any malignancy or any condition can give rise to calcinosis, nephrocalcinosis, or renal tubular acidosis type 1 are ileal diseases in which increased oxalate absorption and urinary excretion is increased, or any inherited condition like medullary sponge kidney and cystinuria can give rise to the nephrocalcinosis. So there are different types of the stones like calcium oxalate and phosphate stones are most common type of renal stones. Oxalate are most commonly present, and then the second most common are calcium phosphate stone. Appearance is irregular with sharp projection, and calcium oxalate stones are most common in adult, with calcium phosphate is the most common type in children. Urine characteristic of these type of the stones is the increased calcium and oxalate and urate and pH level with decreased citrate and volume. Causes of calcium stones are secondary hypercalciuria, primary hyperparathyroidism, type 1 renal tubular acidosis, and sarcoidosis. Secondary hyperoxaluria causes are Crohn's disease, ileal disease, or gastric bypass. So, another type of the stone is magnesium ammonium phosphate stone. These form largest stones of the kidney and also called steroid or triple phosphate. Magnesium, ammonium, and phosphate stone are staghorn calculi are also known as. Appearance is smooth and dirty white with urea splitting bacteria or protease which convert urea into ammonia, and alkaline urine causes precipitation of the magnesium, ammonium, and phosphate, and triple phosphate steroid or staghorn appearance stone develops, and there is increased ammonia, increased pH greater than 7, and other type of the stones are uric acid stone. They appear hard, smooth, often multiple, and radiolucent in the pain film, and increase uric acid and decrease pH. Cystine stone are hexagonal in appearance, translucent, and crystal shape appearance. These are found because of genetic defect in the renal reabsorption and low urinary pH. Calcium clinical features of these stones are the occurs unilaterally, and they possess gross microscopic hematuria with renal colic pain, acute loin pain. Pain radiates to anterior posterior groin. Pain is so severe, and fever is also absent. Diagnosis of these stones will be on basis of the abdominal X-ray shows calcium containing stones in X-ray. Uric acid stones are radiolucent and non-visible. IV urogram is performed with non-contrast spiral CT. Other investigation: urine lysis, urine culture, UC, blood urea, nitrogen, creatinine, electrolyte, and parathyroid level, or phosphate level, and uric acid level also. Acute treatment of these stones. So the treatment is give the bed rest to the patient, and strong analgesics should be given like narcotics, morphine, diclofenac should be given, and if there is obstruction, then urosepsis and intractable pain or vomiting can be there. Acute renal failure can be there because of these medications. Then urological treatment is percutaneous nephrectomy and extracorporeal shock wave lithotripsy, and percutaneous nephrolithotomy with open surgery is performed. Chronic treatment includes increased fluid intake, increased calcium intake, and avoid sodium intake. Food that are rich in oxalate, high protein diet, vitamin C, and vitamin D supplements should be prevented. Then, thiazide diuretics reduce urinary calcium and are useful for recurrent stones and patients with hypercalciuria, and uric acid stone urine alkalization should be prevented, and for magnesium stone antibiotics should be given to treat UTI and urological intervention. For cystine stones there should be urine alkalization, penicillin, and diapronin captopril should also be given. So in this way we can treat the stones of the kidney.